So, very good afternoon and a warm welcome to everybody. So, we are here today in this live session to talk about Lasik. So, I'll be discussing it in terms of the common questions and the common queries that I get from my patients. And at the end of that, we'll take some questions and anything that you want answered, we'll be happy to address that. So, to begin with, I mean, I'm sure that all of you have heard about LASIK. All of you have some idea because it's a very commonly performed surgery. It's something that a lot of people might have gotten done. So, to begin with, a common question is, what is it? What is LASIK surgery all about? So, LASIK is essentially a refractive surgery, which means you are getting the surgery done to get rid of your glasses or your spectacles or contact lenses, and it is done by altering the shape of your cornea. So your cornea is the outermost transparent layer of the eye, and using a laser the shape of that cornea is altered, with which you are able to get rid of glasses. Now, another common question is, what are the types of LASIK? Essentially, there are two types. One is the bladeless variety, and other one is the one with the blade. So the surgery, the process being done here is pretty much the same, except that the cut that is made in LASIK in the blade variety is done using a specialized mechanized blade called a microkeratome, and in the bladeless variety, this blade is replaced by another form of laser called femtosecond laser, which makes the cut by itself. And what is the difference between these two? In terms of visual outcomes, both are very, very similar because they are essentially doing the same thing. The difference varies a little bit in terms of the safety outcomes. So even though the blades are quite reliable as well, there are still some potential possible complications that can happen, which are extremely rare but possible. In bladeless, the possibility of these complications is nearly eliminated. It is almost zero. And which surgery should you get done? I think it depends a little bit on the cost factor as well. So bladeless is a little more expensive and blade is a little more reasonable. So if you are able to afford, then go for bladeless. In bladeless, there are different varieties as well. You must have heard of things like Lasik, Contora. These are all specialized different forms of LASIK surgery. And I think what is most important is to visit a refractive surgeon that you trust, a refractive surgeon that has a good track record, people who your friends have gotten operated from them, a reliable hospital, and get the surgery from them. Which brand name you go for in terms of LASIK surgery, I personally believe is not that important. Now, who is eligible for LASIK? So can anybody get their glasses removed? Can anybody get LASIK surgery done? Well, there are certain criteria that need to be fulfilled for anybody to be able to get LASIK. The first and the most important thing is you need to be at least over the age of 18. Your refractive error, the power that you have in your glasses, has to be stable. So if your power is fluctuating, suppose it was -3 diopters a year back or 6 months back, and now it is -4 diopters, that means your power is not stable. So you should not get LASIK surgery done if your power has not stabilized as yet. Then there are other factors that we look at. We do certain scans in every individual, which basically looks at the shape of the cornea and the thickness of the cornea. So anybody who has an extremely thin cornea and somebody who might have a potential weakness in the shape of the cornea, those are individuals we do not do LASIK in, because those individuals, it is not safe to do LASIK in. Anybody else whose corneal thickness, corneal shape is good, who's above the age of 18, and who is otherwise having a refractive error that is stable, can undergo LASIK, provided there are no other ocular conditions in the eye or systemic conditions that prevent us from doing the surgery. Is it safe? Well, it is one of the safest surgeries that exists on the human body. It has an excellent track record. It has been there for many, many decades now. And there have been continuous improvements in technology that have been happening, not just in terms of technology that is part of the surgery itself, but also technology regarding the diagnostics, the post-operative care, and in all ways. So it is definitely one of the safest surgeries that exists on the human body. At the same time, however, you should be aware that any procedure that you undergo on anything in the human body involves some risk, and which is why it is extremely important for you to discuss the benefits and the risks that are associated in your particular case with your refractive surgeon, so that you can take an informed decision on whether LASIK surgery is something that you want to go for. Another common thing that I am often asked is the surgery painful? Well, the surgery per se is not painful. You will feel a little bit of touch, a little bit of pressure when the surgery is going on. You will not have pain during the surgery. You will be quite comfortable. There is no injections, etc., that are given to anesthetize the eye. It is just drops that is given, and the whole process as such is quite comfortable. The day of the surgery, once you go home, you might have a little bit of discomfort, watering, blurring, etc., which is absolutely normal. And the next day onwards, you're quite comfortable. Next day onwards, your vision is also usually pretty good. And then the quality of vision keeps getting even better over the next few weeks. How long does this surgery take is again something that I'm asked quite often. The surgery usually takes between 10 and 20 minutes. The part where we are doing the laser to correct your power is taking just a few seconds, about 30 to 60 seconds. But the whole process of moving you into the operation theater and doing all the steps and then you walking out of the operation theater takes about 10 to 15 minutes, maybe 20 minutes sometimes. And how is it post operatively? What is the recovery like? So, like I said, on the day of surgery, you might have a little bit of discomfort, blurring, pain, etc. And the next day you're quite comfortable. The next day your vision is also pretty good. You will be given certain medication that you will be starting on the day of surgery. You would need to use that for about 4 to 5 weeks and continue follow up with the treating ophthalmologist. So on the day or after surgery, you would be examined by the refractive surgeon a week after surgery, a month after surgery, and then usually 3 monthly and then 6 monthly. So you should maintain a regular follow up after your surgery is done. So that's important, and it's extremely important to stick to the medication schedule that has been provided to you. There are certain precautions that you need to take after the surgery for a short period of time. It's important not to rub your eyes. It's important to avoid dust and water in the eyes for about a week. So for a week, it's always better if you don't splash water on your face or splash water in your eyes. Just being a little extra careful doesn't harm anybody. So it is important that you take certain precautions. Go easy with your screen usage for the first couple of days. If you start using screens suddenly after surgery, you might have a little bit of strain headache because you're adapting to a new optical system, and you will be extremely happy with your vision and you will not be wearing any glasses. So you would feel that I can do all my routine work, get back to screen usage. But if you use it excessively to begin with, you might have a little bit of straining, discomfort, etc. So always good to go easy on that. Then there are people who ask that when can I start swimming after surgery. So swimming is one of the things that we suggest that you wait for about 3 months after surgery and then start swimming, because it's we don't want any infections or any other complications happening. Then there are other questions that are asked. There are certain individuals who are not eligible for LASIK. So we discussed who is eligible for LASIK. Now, what about those who are not eligible for LASIK? For example, if you have a very high refractive error, or if you have a thin cornea which cannot be treated by laser, then what is the option that you have? So the option that you have is something called an ICL, where there is a lens which is implanted inside the eye. Now that again also is quite a safe surgery, and again there are certain measurements that are done, certain scans that are done to a certain suitability for that. And if you are suitable for it, ICL is again a surgery that takes about 15 minutes. There are customized lenses that are ordered based on the measurements of your eye, and following that, the lens is implanted inside the eye, and this again provides extremely good visual outcomes, has an extremely good safety record. uh, so it's an option that you have even if you are not eligible for LASIK. So this is the basic outline for LASIK and any form of refractive surgery. What I'm also again asked by a lot of patients is, should I get refractive surgery done? Should I get LASIK done? And my answer to them is that LASIK is one of the safest surgeries there is. Whether you should get it done is your personal choice. If you are happy with glasses or happy with contact lenses, you don't necessarily have to get it done. But if you do believe that glasses or contact lenses are interfering with your routine life, or in terms of cosmetic appearance, aesthetically you feel that you don't want your look to be associated with glasses, which is fair enough, then definitely LASIK surgery or ICL surgery is extremely good, and it provides extremely good outcomes. Patients are extremely happy, and a lot of patients tell us how it has dramatically improved not just their vision but their overall quality of life. Because what you also end up getting is, especially in people with high powers, is your quality of vision is in fact even better than what it was with glasses. So it dramatically does improve the quality of life of an individual should they choose to get one of these refractive surgeries. So I'll be happy to take some questions now. uh, let's see what questions the audience has, and let's see. So, Ms. Muskan wants to know, when should I plan to get a LASIK surgery done? So, I think that's completely up to you. You can get it done whenever you want. There is a workup and a dilated retina checkup that needs to be done before you plan the surgery. If you're traveling, it's important that you keep at least a week to 2 weeks after the surgery so that you can get your follow-ups, you can get comfortable, start using your medication. So, whenever you can take about a week off from work so that you can be compliant, take a little bit of rest after surgery, that's when you should plan. So it should be planned based on your schedule and your routine, and when it is convenient for you. Other than that, it doesn't really matter when you plan to get a LASIK surgery. Any other questions? So, what should be done during the Mr. Ravi wants to know what should be done during the recovery period. So, like I said, on the day you get surgery done, you will have a certain amount of discomfort, which is extremely normal. So, try and get some visual rest, wear some dark glasses, even at home on the day of surgery. Keep using your drops. On the day of surgery, if you feel the need for a painkiller tablet, you can take one. And the next day onwards, you are usually quite comfortable and your vision is quite good. So in that period of time, you will feel that you're completely okay and you can do anything you want. But it's still important to take certain precautions. Like I said, try and avoid washing your face and your eyes a week after surgery. And also try and avoid splashing too much water on your head, because you will have water going into the eyes as well. So for a week, if you can take that precaution, it's really helpful, because we just don't want any infection entering the eye for a week after the surgery has been done. Also important to avoid rubbing your eyes, because you might feel a little bit of discomfort because you're using drops. So important to avoid rubbing the eyes. Other than that, you can start your routine activities about 5 to 6 days after surgery. In fact, even your work or your computer usage, you can start after 5 to 6 days. And what I usually suggest to my patients is, start slowly and increase your number of hours on the screen gradually. So if you suddenly start with 12 hours a day of screen usage, you tend to have a little bit of headache, strain, etc., because you're getting used to a new optical system. So always better to start with a couple of hours in a day and then gradually increase as and when you get more comfortable. So any other questions? So Ms. Divyangi wants to know, what is the risk of complications with LASIK surgery? So, like I said, any surgery on the human body does involve a small minimal risk. LASIK is one of the safest surgeries there is. Chances of serious complications with the bladeless technologies, especially with the diagnostic tools that we have now, are extremely low. But you can never say that there is a 100% guarantee for any procedure, or there is 0% risk, because that's not how the human body is. So there is that minimal risk involved, which you should be aware of, so that you can take an informed decision. But that risk is extremely low. There are certain issues that commonly happen. There is a slight chance of dryness of the eyes increasing, because you're using a lot of drops as well. A few people have certain issues like halos around light at night, or a little bit of glares at night. These things are relatively common, and these are transient, and these are again not serious complications, because most individuals, and nearly all individuals, get rid of these issues in a few weeks after surgery. And serious complications, like I said, especially with the bladeless varieties, are extremely rare. Any other questions? Okay, so Ms. Juhi wants to know, what will be the recovery time. So you are, like I said, you are seeing very well the next day after surgery, and you are quite comfortable the next day after surgery. there is often some amount of discomfort, a feeling of dryness that can persist for about a week to 2 to 3 weeks in some individuals. And that is why you are given drops, which gradually improves that. So the healing is quite fast. I mean, the next day, there is the flap that we have created has healed by itself. There is no need for any sutures or anything of that sort that is needed in Lasik. And within a week, you can get back to your routine activities. Any other? Okay, so again, is the surgery painful? No, the surgery is not painful. When the surgery is being done, you do feel a little bit of pressure, a little bit of touch, because obviously there is no injection that is given to you to numb the eye. It's just drops that is given. So you do feel a sense of touch, but there is no pain that is associated with the surgery. Any other questions? So I think that's all as far as the questions are concerned, right? Okay, so I think that's all. So pleasure being a part of this live interaction, and hopefully we can do more of these often. And do let us know if there are any other topics that you would like us to cover, and we would be happy to discuss that with you. So thank you, and thank you for joining us today.